It's important to me because I feel a responsibility for our University of Arizona community, Southern Arizona, the state, the country, the world. So in our little way, by just coming and getting vaccinated, we protect ourselves and we protect others. And it's really important right now. We have a sense of urgency about this because the longer we stay unprotected and unvaccinated, the virus is going to continue to mutate. What the virus is trying to do is mutate to survive. And if we can get everybody vaccinated, then there will be no place for that virus to survive.
Good afternoon, everybody, and thank you for joining us. President Robbins is extremely excited to talk to you today about the university's pod and the governor's announcement today. He'll take your questions at the end of his remarks. Just please make sure that you raise your hand and type your name and your news organization into the window, and we will get to your questions as soon as in the order that they were asked. With that, I'll turn it over to you, President Robbins.
Thank you, Holly, and good afternoon, everyone. Thank you for spending a few minutes with us. I don't have a lot to say because I want to get to your questions, but we're incredibly excited, as Holly said, about the announcement that the governor made that there will be a high throughput pod in Southern Arizona on the campus of University of Arizona. We've been working with the county health department, with Dr. Garcia and Dr. Cullen and Mr. Huckleberry, and we're extremely appreciative of the collaborative partnership that we have with them. And that's been working very well. The governor, based on the success of a couple of high throughput pods at State Farm Stadium and Phoenix Municipal Stadium, thought that Southern Arizona could derive benefit from having a high throughput pod. And we're happy to provide that. We've already got a very efficient pod running right now at about 1,000 vaccinations a day. We had already planned with the county to move that up to about 15 to 1,600 a day. And by increasing the availability of time, meaning we'll first go to a second shift. So right now we're doing about 1,500, or the plans are to do 15 to 1,600 in a 6-hour period. We'll move that to 2 shifts of 8 hours and increase the capability by having more longer hours to deliver vaccine. We think that's worked very well in Maricopa County, and we look forward to continuing our partnership with the state, the county, and the university to serve our community. There will be a transition from the current registration with the county to the state registration system, and we'll be ready to go February 18th. And we can provide all the details of how that'll happen. I think I want to stop there, Holly, and take questions.
Well, good news. You've got a lot already in the queue. So the first question will go to Paul Ingram. Paul, please just introduce yourself and tell us what news outlet you're with.
Hi, my name is Paul Ingram. I'm with the Tucson Sentinel. And the big question that I had is, is this going to come with additional vaccinations or more that will come to the county that'll make it more available? Or is this coming from the county's allocations of vaccinations?
Yeah, Paul, that's one of the things is we began these discussions that, we made very clear. We're happy to do this, but we need incremental vaccines to come because right now, we've got incredible work going on through the county's pods at TMC, at Banner, at Tucson Convention Center, and at the university. So we thought it would be the wisest thing to say, okay, we're willing to do this, but it needs to come with incremental doses of vaccine for Pima County and our pod. So we want it to be accretive, not dilutive of what's going on already. And so the problem, of course, is that I think this week we have about 18,000 doses coming to all the pods in Pima County. Last week, it was about 30,000. And they distribute what they get from the federal government. I believe, and I'm confident that the increased production from both Moderna and Pfizer will result in an increase nationwide of vaccine, and we'll get, of course, our proportionate share of those vaccines. I also made the point with the governor that we've got an older population in Southern Arizona, a higher degree of individuals that are vulnerable and at risk. And so we think it's logical to increase our share of vaccines above and beyond what we're getting right now. But of course, the gating factor in all this is how much vaccine the state gets from the federal government. And like I said, I'm hoping that on the order of 20-25% increase that we'll see coming out. The last thing I'll say about this point is we're very eager to see Johnson & Johnson get approved and start getting in the supply chain, because of course that one is one dose, and we think by having 3 options, we'll be able to vaccinate as many people as we possibly can, as soon as we possibly can, which is the guiding principle here.
Our next question comes from Peter Samore. Peter, please introduce yourself and announce your news organization.
Thank you. Good afternoon. Thanks for being available. Peter Samore, KTAR News in Phoenix. Will Pima County lose vaccine doses to the state this way to fuel the pod, so to speak, on your campus? And a second question, is this perhaps too early of a preparation for expanded capacity without more doses?
Yeah, it's a good question, Peter. And of course, the state is the one that makes the decision about where the doses go. We don't make that decision, and the counties don't make the decision. My understanding is it comes in from the federal government to the state, and then it's distributed to the counties. So as I said to the earlier question, it makes sense to us that we would get a higher proportion of the state's allocation from the federal government. And we think that'll come with this increase in productivity coming from both Pfizer and Moderna. And then once J&J comes online, it'll be more vaccine that we can distribute. And my hope is that the timing is right to where we can continue the allotment that the county's getting for all of the pods that we're currently all running, and that this would be incremental doses that would come to fund or to supply this state pod at the university.
Our next question comes from Patty McAlure from the Arizona Daily Star. Go ahead, Patty.
Hi, Dr. Robbins. Thank you for your time this afternoon. I wondered, have you received, or have you been told that you will receive, I should say, more money from the state in order to get this underway? And if so, how much? And any extra workers promised?
Yeah, so I'm sure somebody's talking about the money. What I've been focused on this whole time is what can we do to get the vaccine out as soon as possible? We would hope that the state will provide some funding to help cover some of the cost. But my approach has been, with CARES money coming to the university, we could use some of that money to fund this on the front end. And then if we can get reimbursed for our expenses on the back end. But we see it as a land grant university. It's part of our mission to serve the community. And I can't think of a better way for us to do that than providing this service to our citizens. We will be working, the state has I'm assuming it's a contract with DEMA to provide us additional workers, whether it be vaccinators or EMTs in our observation area, or pharmacists to mix the vaccine. And then we're going to have to recruit volunteers to help us out. And I'll just say, I couldn't be more proud of the University of Arizona community and how people have really taken this project on to get the vaccine out to as many people as possible as soon as we can. So we're making use of people coming to us and public health students, nursing students, medical students, faculty members, staff. I mean, people are over volunteering in the pod, and, you'll look back, in 20, 30, 40 years and say, I remember, I remember myself when I was a kid in a little town in Mississippi, going to the local hospital and standing in line and getting a sugar cube to get vaccinated for polio. And to be part of something that can help the entire community, I think is pretty special. So our whole community is really energized. They're committed. They're doing a great job. Someone told me that from the time they turned off Campbell Avenue until they got back on Campbell Avenue last week, it was 19 minutes. And that's with 15 minutes of requisite observation after the vaccine was delivered. So we take great pride. Chris Kopak, our incident commander for our SES unit here at the university, he and his team and Mike Stilson and the medical team at Campus Health have done just a tremendous job to get the logistics of this worked out and make it work.
I think Patty has a follow-up, so I'm going to go ahead and open. There we go. Go ahead, Patty.
Oh, thank you. I was thinking it would be along the line, but it's very quick. So do you have any concerns about traffic and having more people moving through the campus? We discussed the Rito site, which is a natural setup for that kind of flow. So do you have any concerns, or will there be any changes on the campus in order to accommodate more people?
Yeah, it's a good point, Patty. I'm always concerned about everything. Every little thing that goes on at the university, I'm concerned about. And the traffic situation is one that certainly we're concerned about. I think one of the real keys in the whole supply chain and the logistics of this operation is the registration system. So if we know when people are going to be coming, and the registration system's working, it is really like clockwork, average of about 22 to 25 minutes. And that's with that requisite sitting in the Richard Jefferson part of the mall on the lawn there, getting checked after people get their vaccine. We also have a walk-in clinic in the Giddings classroom for those individuals that don't drive or take public transportation. So I think it's going to be okay. And by expanding the hours, we constantly have events like the Festival of Books. We have over 100,000 people coming to the mall, and Chris and his team, through their logistics planning, have paid meticulous attention to all the details. And so far it's working well. If we find that one of my big concerns that you're pointing out is having big traffic jam on Campbell, and it goes all the way back up to Speedway and Campbell, and we've got a mess. So I'm confident we'll be able to work through traffic and traffic flow issues and do it safely and efficiently.
Our next question comes from Craig Smith from K-Gun. Go ahead, Craig.
Patty actually covered a lot of what I was going to ask about. The judge, Dr. Chris, said that today they're going to apply the state age brackets, which means 65.
Right.
And the county has said in the past that could add something like 200,000 people to the mix. So, I mean, you've already addressed some of the crowd concerns. Do you have a standby ability to call on extra resources to direct traffic, or maybe even move your whole operation to a more spacious part of the campus?
Yeah, Craig, thanks for coming every week. You're a loyal attender to these briefings, so I appreciate your question. There is always all hazards planning that goes on at the university through our ICS process. And there have been over decades studies to look at where we could do this most efficiently. And the mall was the site. And, Chris and the ICS team, we pushed on them pretty hard to say, well, why don't we bifurcate it and have part of it go to maybe the stadium or the basketball arena and divide it up into two sites. But you lose economies of scale doing that. And I'm pretty confident we've got those backups if we need them for overflow. But right now, as I said, if the registration system works, it should be pretty smooth. We've been delivering almost 1,000 doses in a 6-hour period. So we have plans to increase that to between 1,500 and 2,000. If you run that 24 hours a day, you get to that 6,000 to 8,000 doses per day, which we need to do in addition to all the work that's going on in the other pods at TMC and TCC and Banner. And importantly, the work that the county health department is doing with mobile units. That's very important to get out to where people who don't have transportation can go to. I think Mr. Huckleberry told me over the weekend they went to a church and vaccinated 500 people in a couple of hours. And most people just walk there to their local parish church. So we think we got the capability for overflow and contingency plans if we need them. And I would say, Craig, the state came down and, they've been at this at State Farm. And I don't know if you've been up there to see that, but it runs very well. And I'll say too, we went over and studied what TMC is doing. They're doing phenomenal work at TMC, and obviously Banner is too. So all we are trying to do is all work together to get as many people in Pima County vaccinated as fast as we can. As I said in the video, the faster we all get vaccinated, the less chance that the virus has to mutate.
Great. Our next question comes from Bailey Ocarroll. Please introduce yourself and let us know your news organization. Go ahead.
Hi, my name is Bailey Ocarroll. I'm with KOLD, obviously in Tucson. I'm wondering if you have heard any, I know the traffic concern was brought up. More students are going to be coming onto campus too. Is there concern about, neighbors who live across the street? Have you heard anything from them? Because again, Campbell is busy already. And do you have added concern with those students coming back soon?
Well, the students are here. The students, we think there are about 20,000 students who've been coming on and off campus every day. Certainly that was the case in the fall and has been the case in the spring, because they come on to go to the rec center or go to the union to get food. So they're primarily just walking from either their dorms. We've got about 5,000 to 6,000 students on campus. Now, not all of them are in face-to-face classes now. It's only about 3,800. So we're just increasing by a couple of thousand to get us more in-person classes. But they're essentially going to be walking either from the high rises or the Greek houses or coming on the streetcar. So I don't think that that's going to be a big contributor to traffic congestion.
Next question comes from Eric Fink from KVOA. Go ahead, Eric. Are you there, Eric? Well, the good news is I have him in the Q&A, President Robbins. Oh, okay. So let me give it to you. He wants to know, Dr. Robbins, how many doses will the state-run site need to be able to run effectively? And secondly, what are your main concerns about expanding this site with the limited vaccine supply we already have at the moment?
Yeah, that's the big driver in this whole thing. It's we don't have a demand or a throughput problem. We've got a supply problem, and so I'm concerned about it. But we're targeting, as I said before, between 6,000 to 8,000 doses a day. So if we ran it 7 days a week, we're talking 50,000 doses a week just at our pod. And the most that we've gotten, I think, in any 1 week is around 30,000 for the whole county. So the state has got to dramatically increase if we're going to build this out and take advantage of running a 24/7 operation. They've got to be able to supply us the vaccine, or we'll just keep doing what we're doing.
We have one more question in the queue, and that comes from Kiara Hay from Arizona Family. Go ahead, Kiara.
Hi, yeah, I'm Kiara with Arizona's Family. So we've done a few stories here just about vaccine waste. And I know there's people who kind of wait outside of vaccine sites to get those last doses. I wanted to know if the University of Arizona is going to put out, how many vaccines would be available by the end of the day so they don't go to waste. Is there a plan for that?
Yeah, there is. One of the great things about Pima County, Dr. Garcia and Dr. Cullen and Mr. Huckleberry, if you look at the amount of vaccine that's been delivered into citizens, it's about 85% of all the vaccine that's been allocated, and that's a very high rate. Now, what happens with us is that if we thaw the vaccine, we have about 5 days, if we keep it refrigerated, that we have to use it. So if there are individuals who don't show up for their appointments, we just put it back in the freezer and bring it back and inject it first thing the next day. So there's no vaccine that's being wasted. I think maybe 1 or 2 doses for whatever reason, one pushed a syringe or whatever, but I think it's only 1 or 2 doses out of over 10,000 that, quote, was wasted. So we've been very good about getting the vaccine into individuals. And the good news is that all the appointments at our pod, the county pod that we're running right now, are all taken up for the next 2 weeks. And we anticipate that, as Craig asked before, once you reduce the age limit down to 65, we think there's going to be tremendous demand and open up so that there'll be people who want to come to this pod and get their vaccine. The limiting factor, as we keep coming back to, is will we have enough vaccine, as someone said, to make this run efficiently? We're running very efficiently right now, as the other pods are in Pima County, and we should all be proud of that because that's phenomenal utilization rate.
I almost let you off the hook, President Robbins. We've got 2 more questions. The next one comes from Steve Jess from AZPM. Go ahead, Steve.
Yes, thank you, President Robbins and Holly. So I think you've answered this, but just in case, for people who've already signed up for the vaccination through the county pod, at the point where you're transitioning into the state-operated pod, their appointment will still be honored, right?
Absolutely. The sort of nuance, Steve, is what we do with, if you got your first dose through the county pod, where will you go to get your second dose? And we're trying to work that out. But we'll be switching over from the county registration to the state registration. And I think I was told, what's today, the 10th or something, that by today or tomorrow, we're ready to make that switch. But we won't begin functioning as a state pod until the 18th of February, so a little over a week. And then you would register through the state registration system then.
And Steve, it's also worth noting, anybody who got their first dose through the county at our pod can still register through My Charts in the TMC system to schedule their second dose through our pod through the end of this week. Our next question comes from Bailey. It's a follow-up from Bailey O'Carroll. Go ahead, Bailey.
Sorry, just one last question. Logistically, right now you guys are operating 3 in the drive-through section. You guys are operating 3 lanes. Is that right?
Yes.
But is it correct that you guys have the ability to move to 5 and that's what you're going to do?
Yeah, Bailey. But if you look in there, I mean, it's so much fun to go over there and just visit with people and talk to them. They are so excited that they're getting the vaccine, and they're very appreciative that the university is providing the service, and obviously the state and the county getting us vaccine. But if you look at those 3 lanes right now, we have 3 different stations per lane. So you could think of it as 9 lanes. And we're going to then increase to 5 lanes with 3 different injection sites per lane. So we think we've got the capability. I mean, we're very confident that we could get up to 2,000 doses per 8-hour shift, per 6-hour shift. So that would get us up to the 8,000 if we're running full tilt. Probably will be around 6,000 in the early days. And then if we can get the vaccine and we can expand, we're pretty confident we can get up to that 2,000 doses per 6 hours.
Paul Ingram wants to know, if I understood you right, appointments are blocked out for the next 2 weeks. So when does the U of A expect the appointments for the next priority to begin?
The next priority, meaning staying in the 1B or next available appointment? I'm not sure what.
He typed it in, so I'm not 100% sure, but I think you have the answer to both.
Yeah, so we think that starting the 18th, you'll be able to register through the state registration system and start getting those appointments. And we will start delivering state allocated vaccine on the 18th, and then ramp it up to that next week to where we're pretty much running full speed ahead. Like I think Bailey or somebody asked, if you have an appointment now through the county, those are going to be honored at the U of A pod, and then we'll make the transition over to the state system beginning the 18th of February, and then you just get on and get the appointments. It's pretty amazing at State Farm. I think Dr. Chris told me they're already significantly into March with appointments, and they're running that 24/7, doing about 9,000 to 10,000 vaccines a day.
So we expect our system, the registration for the Arizona registration system for the U of A to open at 9 a.m. on Tuesday, February 16th. And you can go to podvaccine.azdhs.gov to register. Again, that's at 9 a.m. on the 16th. And then you can go to the website, the state's website as well, if you do not have access to a computer, and there's a phone number that you can call to register as well. And one final question.
You may want to read that phone number. I was going to do it. I had some prepared remarks, but I'll let you do it.
I'm going to read it. If you do not have access to a computer, you can dial 1-844-542-8201 starting on February 16th at 9 a.m. to register for the state-run University of Arizona pod.
It's very exciting. I mean, just the ability to expand and to get more vaccine to more people as soon as possible. That's the goal we're all working toward.
We have one final question, President Robbins, and it's from Kiera. As we move through the phases, will the University of Arizona students and staff get priority?
So the phases, so we're at 1B right now. Next would be 1C. And 1B, all faculty and staff at the U of A are considered in 1B. So we've been doing everything we can to try to get all faculty and staff who want the vaccine appointments. So we have to be equitable, right? It can't be just about the U of A. So with the county, we had about 30% of the appointments that the county allocated to the university was for U of A faculty and staff. So we got about 15,000 people. And then we're serving all childcare centers, trade schools, Pima Community College, and K-12 school districts in the county. So it's about 60,000, 50 to 60,000 people that we're committed to vaccinate. And my hope would be we would get it done by the summer. Once we move into 1C, then the question about whether our students would be eligible, and the state believes that students living in conjugate housing would be available for 1C. But that's with the proviso, we've got enough vaccine to cover them. So we've got probably 20 to 30,000 students that are in Tucson. I would love to see our students get vaccinated before they go on summer break, because then it gives us a chance to get all of our faculty, staff, employees, and students vaccinated and get back, after the summer break to more normal. We still won't be normal for a long time, but more normal activities like sporting events and plays and dance recitals and just eating together in the union. That would be tremendous.
Yep. Well, that's all the questions we have. Do you have any further comments to close it out, President Robbins?
No, we always end with bear down and mask up, but all the reporters know that, but I'll still say it because this vaccine is really important. It's one of the incredible scientific marvels of our generation to be able to get these vaccines, multiple vaccines out in such a short amount of time. But we still have to be vigilant. We still have to keep our face covered when we go out. We still have to maintain physical distance and obviously wash your hands, gel your hands as frequently as you change rooms or change places that you touch. And testing will continue to be really important. So, I think we've got to get to that herd immunity, and that's going to take us probably the fall before we get there. My hope is in our community, we can move through our 1.1 million residents and get as many vaccinated as possible by the summer, by the fall, by the end of the summer. And we're just so thrilled and excited about being part of doing something special and positive for our community. So thanks for joining us today. Remember, bear down, mask up.